So this topic is for how to give eye drops. So this is one of the famous nclex topics. You know what happened? Often we skip the easy problem and we always move on to the difficult one. But what happened during your exam, if you keep giving wrong answer, you will get easy topic. And there are some hidden words that you need to know, because often we skip it. We think we all already know about how to give eye drops, but during your exam when you see that words you will be confused. So that's why we often overlook, like, we think we know about the answer but we don't. So there are only 6 steps you need to know when you're giving eye drops. So follow this one and you will be able to crack all your answers. So this is only for eye drops. So maybe during your exam they may give you arrange, select all that apply, or arrange this in order what you will do first. So let's discuss 6 step and you will be able to crack your eye drop answer. So first, you always wash hands. Second, you always put on gloves. Just make a habit of this: wash hand, put on gloves. Now the first step, you will ask the patient to tilt head backwards and ask him to open eyes and look up the ceiling. So like so ask him to tilt head backwards and open eyes and look up the ceiling. So you can give drops. Next thing is, you pull the lower lid down against the cheekbone. You pull the lower lid like down against the cheekbone. Third step, drop medication into conjunctival sac. So sometimes we ignore the famous word. So you must know about this word. They always test it on this word. Drop medication into conjunctival sac. So you must know about this word. During your exam, this is a famous word. Where you give eye drops, you will give under in the conjunctival sac. Now next thing, once you give the drop, you gently ask the patient to close the eyes. Once the eyes is closed, ask them to rotate the eyeball. Gently close the eyes and rotate the eyes around. There is a question came, which one nurse would intervene after giving eye drops? So the patient says, I will squeeze my eyes after the eye drops. So which is wrong. So you always ask patient to gently close the eyes and rotate the eyes around. And the next thing is step 5, to prevent systemic absorption of the medication, apply gentle pressure with a clean tissue to the client nasolacrimal duct for 30 to 60 seconds. So this is another famous word, nasolacrimal duct. You must know this one, and conjunctival sac. So you press the nasolacrimal duct for 30 to 60 seconds to prevent systemic absorption. And lastly, you have to wait 3 to 5 minutes for other drops. Wait 3 to 5 minutes for other drop. So another nclex question, which one would nurse intervene? A patient state that I will give another eye drop in less than 1 minute. So that would be answer wrong. You always have to tell patient to wait 3 to 5 minutes for other drops or other eye medications. Either you will get 3 to 5 minutes, or they will not give you 3, they will give you directly 5 minutes. Why? One of them. So that would be your answer for this. So now let's do some practice questions. So the first question is, the nurse is preparing to administer eye drops. Which intervention should the nurse take to administer the drops? Select all that apply. So can you select all that apply? Are you gonna wash hand? Yes. Are you gonna put on the gloves? Yes. Place the drop into conjunctival sac? Yes. So now whenever you select all that apply, you have to answer yourself as a yes or no. You have to, each option you have to read and you have to say yes or no. That's the way you will be able to crack the select all that apply answer. So let's do it again. So are you gonna wash hand? Yes. Put on the gloves? Yes. Place the drop into conjunctival sac? Yes. Place the lower lid down against the cheekbone? Yes. Instruct the client to squeeze the eyes shut after instilling the eye drops? No, we don't ask the patient to squeeze the eyes. We just ask gently close and rotate. Instruct the client to tilt the head forward, open the eyes and look down? No. You ask the patient to tilt head backwards, open eyes and look upward. Excuse me. So our final answer is 1, 2, 3, 4. So next question is, the nurse is providing instruction the client who will self-administering eye drops. To minimize the systemic absorption of the eye drops, the nurse should instruct the client to take which action? So what we're gonna do? Eat before instilling the drops? No. Swallow several times? No. Blink vigorously to encourage tearing? No. Occlude the nasolacrimal duct with a finger after instilling the drops? Yes. We always apply pressure on nasolacrimal duct. So that would be your final answer. So I hope go over one more time.